Welcome back to our final segment on this fine Saturday morning. You know, we baby boomers or seniors, whatever we want to call ourselves, as we get a little bit older, we have different needs for healthcare. We never know what we're going to be facing. Are we going to twist an ankle or something even more serious that's going to require rehab or some other medical service? Well, I'm here to tell you, you really can't have too many resources when it comes to potential needs for rehab and other related health services. So I am happy to have in studio Jennine Sauriol, who is the Regional Director of Admissions and Marketing for Centers Healthcare. And Centers Healthcare is a great resource if you need one of their many services. And we're going to talk about what their services are right now. Before I get to Jennine, though, write this down or grab a pen so you can have this information available when you want to write it down. 238-3075 is the phone number. That's 238-3075. I will also tell you that their physical location is at 1014 Delaware Avenue, roughly at the corner of West Utica, right in that beautiful historic district of Delaware Avenue. So a great resource for you, a great location. And without any further ado, Jennine, welcome to Senior Matters. Tell us all about Centers Healthcare and the services that you provide.
Well, thank you for having me. And with Centers Healthcare, currently in the Buffalo area, because Centers Healthcare is a very large organization. They actually own 50 skilled nursing facilities in Rhode Island, New Jersey, throughout New York State, and a couple down in Kansas. They also have, they provide the transportation for the 911 services in New York City. So they have their own transportation company. They have assisted livings, adult daycares, they've got quite a few things, home care agencies, as well as the, they call it a CDPEP program, in which you or your loved one could get paid to take care of someone in need at home through Medicaid. We can set those services up for you. We also have both of our skilled nursing facilities in Buffalo, which is Buffalo Center on 1014 Delaware Avenue and Ellicott Center on 207th Street.
So if I were to say that Centers Healthcare is all-encompassing, anything that really would pertain to a potential baby boomer or senior citizen need, it sounds to me like you can readily accommodate.
Absolutely. And one of the biggest things, we were thinking about the baby boomers, and we developed a program, which I think we were going to talk about next, which is our GO program. And the GO program, it allows the patient who's coming in, who suffered a serious illness or injury, and their goal is to get better, get stronger, and get back home. This patient has the opportunity, if they come to a Centers Healthcare facility, to have in their room Netflix free of charge. We have smart televisions in all of our rehab rooms, so that if the patient chooses and wants to surf the web, they can do that at our building on these smart televisions. We also have some laptops available for them to use. We also are offering an upgraded food program so that if you come to our place, you can order like a chicken Caesar salad, and it'll come out looking like you ordered it from the restaurant, instead of maybe your regular institutionalized types of foods.
Yeah, you're listening to Senior Matters here on WECK. I am with Jennine Sauriol, who is the Regional Director of Admissions and Marketing for Centers Healthcare, and that's what we are talking about. You can reach them at by phone, by the way, at 238-3075. Jennine, now I have a question. Your facility would come after a hospital visit. Would this be an alternative to rehab at a nursing facility, or do you actually do treatments? Is it a one-stop shop for minor treatments as well as rehab?
Well, at our facilities, the only thing that we currently offer are inpatient rehab stays. So we don't offer any outpatient services for therapy at this time. But it's an inpatient stay, and it could be after a hospital stay, or you could be at home. Maybe you fell and you're not quite sick enough to necessarily need the hospital. But yet when you fell, you know, as we get older, we bruise a lot harder and we heal a little bit slower and we get a little hitch in our get along a lot quicker than we used to. So those types of things, when they occur, you may qualify or be able to come directly to our facility without going to the hospital, depending upon the situation, in order to get things to get yourself stronger and get back to the life that you were living previously, because that's our goal and that's what we want. Is we want everybody to be able to get better, get home, get stronger, and live their life to the best of their ability.
What type of rehab services specifically are available at Centers Healthcare? I'm assuming that you have some very sophisticated equipment and quite obviously a very well-trained staff. Can we talk a little bit about that?
Absolutely, yes. We do have, in fact, our two Centers Healthcare buildings in Buffalo, New York. Our Buffalo Center has a specific piece of equipment that is normally only found on the East Coast. Sorry, it took me a minute. It's like WEEW. Which way are we going?
Or WECK, which is what we're on right now.
Correct.
Shameless plug for the station, of course.
But we're actually the only facility on this entire coast right now that has this piece of equipment. And those patients that are in a car accident, or maybe they fell down and broke a leg and they can't bear weight on that lower extremity. Sometimes people can't bear weight on either leg after an injury or an illness, and you're like, well, what are we supposed to do with them if they can't bear weight at all? Well, this table actually encases the person so that the physical therapist can pick them right up with the table. They're not touching the ground whatsoever. They're not bearing any weight on that extremity, but then the therapist is able to work on strengthening everything else on their body, the upper body, arms, so that they're not just kind of, in the past, it's either been a situation where they have to kind of sit around and wait and not be able to progress in therapy during that time because they couldn't bear weight. Now with this table, we can get them up and moving right away instead of them maybe sitting around for 8 weeks doing nothing while they're waiting for that extremity to get to the point where they can bear weight.
You know what we need to do? We need to look a little farther underneath the hood, because I'm sure many of our listeners are very intrigued by the information that you're telling them, and they're probably thinking, who qualifies or who disqualifies to attend Centers Healthcare? And I know before we went on the air, we briefly talked about those two M words that everybody over 65 kind of frets over a little bit. We talked a little bit about Medicaid. We talked a little bit about Medicare. But before we get to that, what are the qualifications or disqualifications for somebody to participate in one of your rehab programs?
Well, one of the big disqualifications that I can think of right off the top of my head is I have people that'll come up to me and say, Jennine, I need rehab, but they're walking better than I am.
So reminds me of an episode of Shameless I was watching last night, to be honest with you. Frank Gallagher clearly has tried to get into your center.
But, really, if you're able, inpatient services are required when you really need to have like nurses monitoring your blood pressure, kind of making sure that they're overseeing your medication administration, and that it's not easy for you to get around.
Are there any income restrictions? Is this open to anybody and everybody, or is this center specifically targeting maybe a certain, a certain income bracket?
It's open to everyone. There are not any income limitations. Normally your insurance would pay for a rehabilitation stay, skilled nursing service, whether you have the need for physical therapy, occupational therapy, maybe you need speech therapy, or maybe you have some wounds from a surgery or something like that. All of those things will qualify you to be able to stay with us. And when it gets into the part of where we start talking about money coming out of your own pocket is when you're looking at a long-term care stay. But when you're talking about rehabilitation, your insurance should cover it.
So you are not long-term stay, is that correct?
We do have long-term care beds as well.
You do?
Yes.
That is excellent.
Yes. We have a memory care dementia unit also at our Buffalo Center. And we're in the process right now at our Ellicott Center, because we're in the Hispanic Heritage District. We decided to take one of our long-term care units, and we're going to kind of do a Hispanic unit where we're putting pops of color on the unit that resemble what Hispanic culture enjoys and likes. We're going to have, decorative things on the unit. They like to play dominoes, so we're getting a lot of dominoes and trying to do a lot of the activities, the foods, the things that the Hispanic culture maybe we're used to. We're trying to implement those things into that daily routine so that they would be more comfortable when they come. We also have the language barrier, so that's another reason why we wanted to do kind of a Hispanic unit, so that when our bilingual staff can be on that unit to care for and try and help those patients have a better stay.
So it's really nice that Centers Healthcare readily embraces the diversity and of the ethnicity that's in Western New York.
Absolutely.
I mean, it sounds like you're really going way, the extra mile and then some to make sure that people that need to go to the facility in the Hispanic Heritage District, you want to make them feel at ease and very, very comfortable as they receive their treatments. And that's awesome.
Yeah, well, they are our neighbors. They're in our community. Directly around the facility is a big portion of the Hispanic people that live in the Buffalo area are right there.
Now, the other thing that I wanted to touch on briefly, because more and more people find themselves in this situation, you also mentioned to me before we went on air today that you can also arrange to have family members paid to care for other family members, outside of your facility, but yet you are able to sort of help orchestrate that protocol. Is that correct?
Correct. We have, there's a division of our company of Centers Healthcare that is called Amazing Homecare, which offers in Buffalo, in Erie, and Niagara counties. If you have a loved one or a friend even that is willing to help take care of you at home, our company would get you set up and get you evaluated by the correct people in order to have you qualify for this program. So then in the end, Medicaid would actually pay your loved one or your friend to care for you at home. The only thing that makes me laugh is apparently you can't have your spouse paid to take care of you, and your power of attorney can't be paid to take care of you. I don't know why, but
I can guess why, because that would potentially open the door for some people that would probably abuse the privilege.
The privilege and the system.
I fully get that. And let's be honest, that the more people that would be allowed to abuse that privilege, well, eventually someone's going to pay for it. I mean, the rates are going to go up, whether it be, through your health insurance or through fees that you may have to charge. So I think that's actually not a half bad idea.
Yeah, you're right. I was just trying to be, a little bit of a
Well, I'm the
comedian.
abrasive talk show host. I get to say all this negative stuff.
But Centers is really committed to making sure that people are where they need to be.
Okay, let's once again recap. We've thrown out a lot of information, a lot of valuable information, in my humble opinion. How do people get in touch with you to see what their qualification situation is?
They can call me direct at 716-238-3075. I'll take your information and pass it along to someone that is on my team that would evaluate you and see if we would be able to help you.
And if you didn't get the phone number and you're mad because you couldn't find a pen, well, I'm going to make it easy on you. You can also go to centershealthcare.com. That's centershealthcare.com, where you can find, we've been throwing a lot of details out, everything from rehab to maybe helping people at home, just long-term stays, short-term stays, special equipment they have. There's a lot of information here that I believe is very valuable because as we get older, none of our ailments are cookie cutter. None of them are boilerplate. We all fall into different forms of physical malaise or little minor accidents. And it's nice to know that we have a place, i.e. Centers Healthcare, and a great person like Jennine Sauriol who cares about you, cares about her job, her passion, I'm sure comes through in our chat this morning. This is a great option for you to pursue before you go running off to maybe one of the the other places where maybe you don't really have to go there. Maybe you can get all of your your PT needs met with at Centers Healthcare in a very professional, comfortable setting. Jennine, that's great. I'm so happy to find out about what you do. And how long have you been in Buffalo, by the way, the Centers?
With Centers Healthcare, I've been a little over 4 years.
And the company itself has been active here for how long?
Active in this area for 5 years.
And that, again, simply reinforces what to me is the obvious. It is an accepted fact that Buffalo has a little bit older population.
Yes.
And people also live older. And they also love listening to Weck. I got to throw that out there again, because that is our target audience. And there are so many of us that like to look back on on the recent good old days, and hopefully we're all going to live a long time. Hopefully we're not going to sprain an ankle or break an arm, but if we do, now we have yet another place that we can check out and get that help that we need.
Yes. Thank you so much for having me.
No, thank you. This has been great. I learned a lot in this segment, and I'm sure our listeners did as well. Again, reach Centers Healthcare at 238-3075 if you have any questions whatsoever. All that being said, that puts an end to another really fun show here on Senior Matters. Jennine has been a great guest, as have our others this week. So all that being said, I always like to do the movie thing and say, that's a wrap. Have a great week, and we will talk again next Saturday.